Good evening, everyone. Gareth Presh, host of WHIS Talks this evening. Delighted to welcome you and our guest this evening from Ballymena in Ireland, but lives in London. Ben Wilkins is with us, from the CEO of Good Boost, and Alison Davis is in Cape Town in South Africa, Solaviv. And we're going to be discussing SDG3, good health and well-being, this evening. If you have a question for us or for the panel, please do put it in the chat box and let us know where you're joining from. Let's start with Alison in South Africa. Could you give us a bit of an introduction and tell people who you are and what you do?
Yes, wonderful. Thank you so much for having me on this call tonight, Gareth. So my name is Alison. I am with Solaviv as Head of People Operations. So what we're currently doing is, we're so passionate about the health of individuals, the public, as well as the culture of our employees. So I'm in charge of the hiring of all of our doctors and practitioners on board, as well as obviously our team with Solaviv. We're actually in the process of doing a little bit of a health and wellness app called Holistically. So taking that health and wellness from physical properties to digital platforms.
Super, and I want to go more into the work that you do, in terms of prevention. We'll get into that conversation. Ben, what's the weather like in Ireland? And delighted you can join us and tell us a little bit about yourself and your career and background.
Sure. The weather in Ireland is a bit colder and grey than the 37 degrees it was in London on Friday. So my background is, I'm CEO of Good Boost. Good Boost is a social enterprise that delivers aquatic and land rehabilitation for musculoskeletal conditions. And musculoskeletal conditions is all joint and pain conditions. What we do is we are a team of specialists, experts in rehabilitation, musculoskeletal science, and artificial intelligence. And we develop the AI software to create personalized and individually tailored program in people's homes or in their local leisure centers to be active in water to manage their condition. My background is in musculoskeletal research with a focus on aquatic rehabilitation and peer-led community MSK services. How do you support patients to support each other rather than be dependent on clinicians? I'm also an MSK clinical champion for WHIS Arthritis, the UK's leading arthritis and musculoskeletal charity. And I'm a Winston Churchill Fellow with a focus of research in gamification of rehabilitation exercise for older adults in the community.
Fantastic. And I think this is going to be really exciting to get into the conversation here, because I know Solaviv are developing Holistically, which is around digital applications. So there's a lot of synergies here. First, let's talk about the only topic at the moment, which is COVID-19. Let's get this over with and get a bit of a perspective. Ben, could you tell us a little bit about London, the impact that you're seeing, and particularly around elderly and care homes? If you could give us a perspective of what we can expect over the next couple of months and what you've seen, and then if you have any suggestions around solutions, how can the general public help? And I'll ask the same question around Cape Town. I know you're in a further stage back, but there might be some shared learning here.
Yeah, in London, we are in such a better position than when we were earlier in April and May. The position's improved greatly, but there is no doubt we are running the risk of a second lockdown due to a second spike, because of numbers aren't going up if people don't proactively follow government advice and guidance. From my point of view, from what we do at Good Boost, we work a lot with people over the age of 55. We support a lot of people, older adults. The challenge is that these individuals are going through a deconditioning pandemic. So what we know is they're becoming less active, becoming more sedentary because they can't go out as much. And what the results in very quickly is the loss of muscle mass, which is known as sarcopenia. And that can have a really big impact on people's functional ability to live independently. It means that people are ending up going into care settings or going to hospital because they're falling over, because they've lost that balance and coordination. But more importantly, research is coming through to show that muscle is a highly important part of the overall immune system. And so loss of muscle mass is known as immunescence, which means actually you're having a detrimental impact on your immune system by losing muscle mass. And during a pandemic, your inherent immune system is incredibly important. So from our point of view, older adults need to find ways to be more active. The challenge we have is that they are anxious of going back to public spaces, leisure centres, swimming pools. They are anxious of going back because they're anxious of the risk of infection. So what the public need to do is, I think, be understanding. We're going to have to avoid things like restaurants and pubs potentially, so that schools and leisure centres can stay open to reduce the overall pressure of infection rate. And so I think it's just recognizing the challenges that other more vulnerable groups are going through, and we may have to give up some of our day-to-day luxuries of pubs and restaurants and other social venues to attend.
Yeah, it's absolutely brilliant to get an insight like that, because it's something I wasn't really aware of, as around the boost of immune system and muscle mass, which is a great insight. We learned yesterday about the importance of heat and water in terms of the immune system. So, there's a great opportunity here for us to do some, take self-responsibility, and manage our own health and well-being by improving muscle mass, for example. Alison, from your perspective, South Africa, Cape Town, you're in the middle of a lockdown. Perhaps you could just give us a little bit of an insight what it's like on the ground, and then some of the solutions that you're bringing forward.
Mm-hmm. Obviously, I mean, just like what Ben has just slightly mentioned with anxiety, I mean, that is, I think, one of the primary concerns now. Obviously, with South Africa, we're still in lockdown. We still have to wear masks when we go out. So that creates a lot of anxiety. With public schools they've been locked down at the moment. Private schools are allowed to continue schooling. So this affects the household. How families are living, because this reduces your exercise, your team spirit. You're not interacting with your classmates. So, and then obviously there's pressure on the parents, because they trying to do some homeschooling, trying to entertain their kids, trying to maintain, a job and a lifestyle. So I think that is such a huge concern is the anxiety and the mental health of individuals. And I think, like what Ben has mentioned with the musculoskeletal, when we're not doing exercise, we're not healthy, and you're affecting the immune system. But with your mental stability, if you are stressed and anxious and you're not exercising, there's a whole package that is not taken care of. Obviously, from our side, with Solar Vive, we're introducing a health and wellness app that would hope to reach all of that market of caring for the mental state as well as the physical state from home, and empowering the individual as a client and a patient at home to take charge of their life, care for themselves mentally, whether it's in touch with life coaches, counselors, or then as well as personal trainers. So the whole body is going to be able to be looked after from home.
And I mean, Ben, you talked about AI earlier, and the work that Good Boost does at the moment in the community. And going forward, when we look at how do we build a sustainable healthcare model where we shift the space from healthcare to health, how do you see digital technology and the work you're doing creating opportunities so that we can reduce, should we say mitigate the circumstances that you both just described?
So I think tech has a huge role to play in the future. There is no doubt about that. But also, tech is not the silver bullet. We need to keep remembering that apps don't heal people. People do. About 20% of phones on the planet have a health app on there. However, we have not seen a 20% improvement in overall health worldwide. And that's because just because you have an app on the phone is about your interaction with that technology. We're developing loads of medical technology, but a lot of it depends on the user's activation to keep interacting with it day to day, week to week. Otherwise, there is minimal or limited health benefit. If that technology is about you being proactive to manage your back pain by doing exercises, you may have the app, but you don't engage in it. It may be the best clinical app on the market, But if you don't proactively engage, and this is what we need to remember, is that people are incredibly irrational, because actually we don't do things which is always in our long-term best interest. Hard work, investing in our health, pays off in the future, but laziness pays off right now. By going for the exercise, by avoiding that chocolate cake, the heart attack you avoid is 20 years away. And we're really bad at using that as a motivator to be healthy today. But the great thing is we're highly irrational in highly predictable ways, and we can start designing strategies to overcome that. And the way we need to make technology work, whether it's with artificial intelligence or using different biosensors, is that we have to remember that people's use of them is going to be in their disposable leisure free time. Our competitors are Netflix, Facebook, Twitter, anything that people will do in their spare time rather than looking after themselves, their health and well-being. That's our competitors as a sector. So when we think about technology, it's not the clinical technology underpinning it, but how engaging and attractive it is. We need to make things as addictive as Facebook if people are going to proactively manage their health by using technology.
Yeah, I suppose the next question is, Alison, how do we do that? And it's a very good insight, I believe, Ben. You know, it's probably an opportunity to look at the value proposition. If you talk about what Netflix and Facebook do, they have a huge value proposition. Perhaps this is a strategy that we can deploy in terms of showing the value created by people, shall we say, investing in their health and well-being, what that means for them and what they can achieve. So, Alison, your thoughts on how do we do that in terms of Soloveve's activities?
So, obviously with keeping up with markets, we have a huge panel of researchers that are cranking out data all the time with trying to make interesting articles up to, keeping with what is trending, because we follow what is trending and engage with what is trending and how to also maintain engagement. So there's a lot of work that's constantly going also with obviously our app that we're developing. We're trying to make sure that engagement is there. You can lose your clients and lose your patients so quickly. With us, also, we will have artificial intelligence, and then the practitioners that are on call. So if I come home from work, I'm tired, I'm stressed, let's say, for example, I want to meet up with my psychologist, I can do it then and there. I can make an appointment, I can commit to it. So ease of access, availability is also great. So that is one area I feel, often if you actually still have to leave the house or pick up the phone or do other things, whereas from the app, click, 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 and you've already got an appointment. With our physicians that they will have on board are also going to, be genuinely, passionately caring for the patients and ensuring their well-being and wanting to inspire them and empower somebody from within. So I think that the whole package of the data, the research, the blogs, the articles will have artificial intelligence, ease of access, and the wide range of services that we'll be able to offer via video calls. I feel like initially this is going to really take on because people are locked down, they're stuck at home and they need the love and support.
Mm-hmm. And I think, Ben, the real challenge here is, and again, I come back to, how do we manage to turn people's attention? Because like you say, with the app on the phone, for example, I know I have a health app on my Apple iPhone. I don't use it, and I've spoken to Dr. Amir Hannan previously, who's a GP in Manchester, and he's, digital champion in the NHS. And he was telling me that, he said, Garrett, maybe, I don't know, 60, 70% of people have a Fitbit or have an Apple Watch. And he says they come into me, they never, ever talk to me about their Fitbit, right? They never talk about the data. Now, that to me gives me a great insight into the understanding that is not there, And then if you look at maybe from a political side or a local government side, this is a question, Ben, around how will the local authorities be able to extract the data to then be able to foresee and plan, existing services or future services around cities? Do you think there's an opportunity there?
There is an opportunity for that data to be used, but there's also some real concerns and question marks around data privacy and security at the same time. Yes, we want to make sure we create healthier environments, because actually the best thing we can do for overall health is actually create environments where people are almost encouraged to be healthier just by living in a space. If we can use data to inform that, great. But I think most people, if they bought a Fitbit, do they want to know that they're being tracked to potentially inform future town planning? It's a really challenging one. It's more is around in terms of that is financing these things as well. The challenge we have is that health systems are firefighting every single day, even more so at the moment with the pandemic. But even before the COVID-19, there was still so much pressure on the day-to-day health systems. If we're going to transition to a health and well-being healthcare ecosystem, then funding needs to change, because the health savings we're going to see by investing in prevention and well-being won't be seen for 5, 10, 20 years. And it's really difficult when a health minister or a government that are going to be elected every 5 years to make decisions which won't have a benefit for potentially 3 to 4 new governments' time. That's really difficult. So it needs some really bold and pioneering decisions to be taken that accept that those payoffs will not be in the short term. They will be medium to long term, but they could be tracked. And that way, I believe, whether it's in town planning or the environment in cities, they will be able to make those decisions because they'll have the backing and the fund to do so, rather than saying, well, we should spend it on the problems we have right now, rather than forgetting the things 5, 10 years down the line.
Yeah, I mean, I agree. I think this needs bold leadership and vision. I mean, yesterday we spoke to Dr. Ron Daniels. He was telling me about the long-term impacts of COVID-19, for example. You know, the circumstances that people who are coming out of treatment, the needs that they will need over the next, 10, 20 years, because of cardiology effects, different mobility stresses on them. But he was also said he'd done some analysis, some research around the cost savings to this, for an investment. I think something he said, around $1 million invested gives £200 million return, something enormous like that he was talking about in terms of community investment and that engagement and that information. And I also think if you can leverage that, if you say from Solavi's perspective and Holistic, if you can show the benefits, for example, with suicide or mental health and well-being, cost reductions in terms of, should we say, insurance policies, there are different funding models that you can go across. How is Solaviv going to engage and encourage people to, should we say, I know you mentioned, Ben, the cybersecurity issues, the challenges around privacy, but that already, for me, we need to have that open and transparent conversation with people, because that already happens. Do you know what I mean? Like that, we're effectively with Facebook and other areas, yourself, you walk into a shop, you get it, next minute you're getting advertisements. But we need to be totally honest with people how we're going to do that. Is Holistic's solution going to be, secure? And what's the strategy there, Alison?
So yes, the idea is to have it all secure with data, obviously data privacy, but we also, I think from our side, we wanting to make sure we integrate within ourselves, so within Solaviv and within Holistically, so all the doctors and physicians would gain access to specific patients, so they could, instead of having to like reshare their information in the team. So you gain access to see what, let's say X patient has psychological concerns, and then the personal trainer can gain access to make sure there's a full holistic approach that we have, and gaining it, but not really going to be sharing that data at this stage.
Yeah, no, and I know a lot of companies as well. One of the encouraging signs, the tech companies are actually taking a little bit of ownership. We've had some conversations with some big multinationals, and they're very adamant that it's end-to-end encryption. It was one of the, and they're actually installing that as part of their, should we say, infrastructure. I mean, 5G is coming as well. I mean, there's a lot of, the data that I was talking about, Ben, with 5G, for example, for cities, you can you can then foresee, you know, the prevalence of, say, cancer, for example. You know, you can plan your services, predict what you expect based on, you know, will people take their bike to work? Will people take public transport to work? So there's a lot of opportunities there. But if we go back to the work you're doing with Good Boost, Ben, can you tell me what do you expect to see in the next 12 to 24 months? Because we've had a lot of problems with elective surgeries being delayed, and that's going to have a knock-on effect to elderly and frail care. How are you going to prepare, and colleagues within, you know, public, private, voluntary sector, how are you preparing for that?
It's going to be a real challenge. In the UK alone, every year there are 220,000 hip and knee replacements that take place. This is not an insignificant number every single year. We've had around 6 months of lost elective surgery, and when there was already a waiting list up to 18 months in some cases to have a hip and knee replacement. There are going to be some real challenges around this, because we've got a backlog of the entirety of physiotherapy, orthopedics, MSK services. It's going to be essential that we focus on how we can support people remotely as much as possible. This is not going to be the solution for everyone. People who can receive remote support, who are happy with video calls, who are happy with telehealth, fantastic, because that will take away the overall burden from those who definitely need to have that face-to-face support. Is still a big question mark around community services, because it may not be until spring, summer next year where we are in a position where people feel confident enough to go out and access faith centres, community hubs, to engage in self-management services. But what's really important, what I can see the entire MSK charity sector and sector doing, is working out how they can best support people remotely through telephone, through websites, through apps, to make sure people can self-manage. We know that things like hip and knee replacement, which the primary reason is late-stage osteoarthritis, you can do a good amount of self-management and the reduction of pain and improvement of function through evidence-based rehabilitation exercises. So it means we can keep people sitting independent for longer, better manage pain for longer, so they can wait for that hip and knee replacement. But we've also seen great actions from patients too. I know of colleagues who have had patients call them up to say, I can wait. There are people out there who have greater needs than me right now. I can wait at the moment. But that's gonna clog up as well. All the people who have done that, have been willing to volunteer and wait, they will get to the point where they're going to get a worsening of their condition, and it's gonna hit a car crash. So we need to make sure we put those remote services out there, because it will then take the pressure of those who definitely do need that face-to-face support.
Yeah, it's a really difficult one, that, because I know, you know yourself, where people think they can wait when really they can't wait, because they don't have the clinical knowledge to make that decision. But they're saying, well, the pain, it's a threshold I can live with. But the problem that most people don't understand is that this has a knock-on effect. So usually it can start with the knee or the hip, but all of a sudden that can develop into cardiovascular problems, which then leads to a heart attack. So a lot of people don't understand that by having the delayed surgery on the hip or the knee, it leads to other conditions. Alison, from your perspective, because you guys have a strategy which is really exciting, because you're doing the digital side of things, but you're also going to be doing physical properties. You've got big ambitions there in terms of being able to support local communities. You're working on Sustainable Development Goal 3. You're partners with UNGSII Foundation. Where do you see that opportunity emerging? Because you're based in South Africa. You've got I think the headquarters is in Germany, and you've got other locations that you're developing. You guys must be excited. Tell us a little bit about what the plans are.
So obviously, yes, physical properties is a huge priority, because, like Ben has mentioned, some people still need physical contact and a physical therapy. So it is very important to have that physical property, and that is where Soul Aviv comes in. And we still want to be able to provide that facility where people can come, whether it's a getaway, a stay, a resort lifestyle, with all those doctors, physicians, spiritual health leaders, everybody to come and integrate together and provide that total well-being for the clients. as you know, with COVID, obviously people become very anxious. They are, haven't got the confidence to do all that travel just yet, but the demand is there still for individuals to, they're more aware and more alert that they need to improve their health. Preventative health is the way forward. So before you get sick, before you get COVID, before you get any illness, we need to improve your health. So that is definitely an area which is not going to be put under pressure as such. People are interested to take that lifestyle resort living of health and wellness. So a getaway where you've got all your doctors and physicians, personal trainers that can do the whole body healing, from your nutritionists even. It's a total package. And I feel like, with COVID, it's enlightening people to realize that the power is in their hands to take control over their body, take control over their health for the preventative reasons, not just for treatment of once you've actually got the injury or once you've got the illness. It's to improve the body's health in preparation should something go wrong, or should you get injured, should you break your back or hurt yourself, your body is in a better condition.
Yeah, no, absolutely. And Ben, perhaps do you have a little bit of advice for people who are listening, watching? Do you have some advice for people? What's the sort of exercises that they can do? Just simple things, plank. I don't know. Is there a couple of tips that you have for people who are joining us? Can you give them a little bit of advice in terms of muscle mass, how to maintain that?
Sure. Generally, the best position or the best posture is the next posture. By that, what I mean is try and be as mobile as possible. Try to sit as limited as possible. That's the most important thing. If nothing else, make sure that you take the stairs. If you've got a step in your house or your garden, you use it just to step up and down sometimes. Simple things such as just rising and sitting from a chair as many times as possible for 30 seconds, a minute, and repeating that a couple of times while you're boiling the kettle. Really simple things can make a really big difference, because to create a change in our muscle mass, we have to push it to a point of physiological change, which means we have to put it beyond our normal capabilities. We need to be doing it to the point that we feel we're working those muscles. So I think that's the most important thing from an exercise point of view, is just do something rather than being sedentary. My favorite one is, I've got a friend who puts her chocolate in her attic, and that's for two reasons. One, it means that it's further away, so she has to really want it to go up there, but also she's got to climb 2 flights of stairs to get up in the first place, then back down again. So actually, if you can change your environment, which means you move more ways more often, that's a really great way to do it, because as humans, we are inherently lazy, and we're meant to be. Evolutionarily, we're meant to conserve energy, so we find it really difficult to be active when we don't have to be. But if you can tweak your environment a little bit, that you are more active, that's a great way to do it.
Yeah, it's a fascinating strategy. I think it's something to think about when after I have my cup of tea, I'll put my biscuit upstairs and then have to go up and down. Alison, just from your perspective, next, should we say 12, 24 months, your plans, because you guys are moving towards a digital solution, and then you're also looking at the physical properties. So there's a big expansion on the way. Probably very timely. We're looking at a lot of investment coming into this area. What's the priority for you guys in the next 12 months, 24 months?
Obviously, for the current situation with COVID, priority is also making sure that we get holistically out there, so we can treat all the patients and clients out there immediately. So I'm obviously we're hiring practitioners constantly, anything from personal trainers, psychologists, counselors, a whole team of practitioners and physicians. And then, moving forward from that, we would be going into our property development. So probably in the next 6 weeks to 10 weeks, we'll be able to have a little bit more details to be able to share with property development. But that is obviously our goals for SolarVive.
Brilliant. Last word to you, Ben. I mean, we've covered so much in this discussion. It's been fantastic. Can you tell us, Good Boost, next 12, 24 months, priorities for you, and where do you see some of the opportunities, perhaps?
Yeah, our priorities are supporting those who are at the greatest risk of poor musculoskeletal health. We know that MSK conditions is a very unequal disease, like most are, and those that are at greatest risk and those who affect most are they are those of the lowest income households. So it's how do we make sure we democratize the access to any digital MSK health service like Good Boost and others to make sure that people can be better at supporting their health. Often prevention and well-being is a luxury. It's usually not something that is easily accessible and affordable. So that's our real focus, is how we do that. Our focus is how do we respond to the leisure sector and move to grow into more swimming pools, both in the UK and abroad, when so many have such an uncertainty over what the next 6 months presents to them. Our focus, though, in our opportunities, and I think what the opportunities are for all of health, is to really figure out what it is that motivates people to engage and be proactive in any activity. Great examples around fundraising is that if you fundraise in a group of people together to hit a step target or a cycling target, whatever it is, you are twice as likely to achieve your goal because you have that social obligation to achieve it with other people. How can we tap into those the psychology behind that and the motivators behind that to get to people to be more proactive in their health because of those kind of tricks and tips that are just innately within our psyche. And the other is to remember that friction is a huge barrier. And the moment there are too many steps in someone engaging in their own health or managing their own health, they won't do it. Great examples. Amazon went from 5 clicks to 1-click ordering, and they attributed about $300 million in one financial year because that one change. Friction is a real thing. The same with Deliveroo. When Deliveroo opened, there was about a 6 to 7% growth in delivery takeaway deliveries compared to just normal restaurants because they'd removed friction from the majority of people. Friction is a real thing. The moment there are too many steps for someone to manage their health is already too much. So not just as Good Boost, but all healthcare providers need to work at how we reduce friction to make sure people just do it without thinking about it, because it is effortless to start taking better care of our health and well-being.
Yeah, it's a brilliant way to end the conversation. I think one of the things I was going to touch on there, because you're absolutely right. We have this, my thoughts are around helping others, for example. Like, so we tend to want to help others. So if you look at the charitable side of things, we will run straight away to do a charitable event for charities. And so we're automatically conditioned to help others. One of the things I always ask, I was recently done a fundraising, a charity event for Cancer Research UK, and it was a 5K with my daughters. And what I found was that what was bizarre was the fact that we had no clinical colleagues from the NHS in that space, because that was an opportunity in terms of being able to disseminate a lot of information around cancer and raise public awareness. So perhaps the engagement process needs to slightly change. Listen, I'm very grateful for your time this evening. Thanks to Ben and Alison, and you know, they can get in touch with Good Boost and Solaviv online. We've really enjoyed the discussion. Thanks to everyone who's tuned in and watching this on replay. We'll be talking to Rich German next week. We'll be touching on life underwater, so it's SDG14. Really excited to talk about that. We'll be talking about plastics in the ocean, its effect on healthcare. So tune into that session next week at 7 p.m. And then the following week, we'll be talking about space medicine and immersive technology as well, and VR. So we've got an exciting couple of weeks coming up. So thanks again to Ben and Alison from Cape Town and Ballymena, and we'll sign off this evening. So good night, everyone. Thank you.